Good afternoon, and welcome to the Veterans Town Hall with Secretary Dennis McDonough, coming to you live from the Washington, D.C. VA Medical Center's Freedom Auditorium. I'm Jose Llamas with the Veterans Experience Office, and I'll be your moderator. Today, Secretary McDonough will be taking questions from a live audience, as well as from veterans calling in on MS Teams today to ask their questions from around the country. For the audience, if you haven't already done so, please silence your cell phones. All right, thank you so much. Mr. Secretary, welcome, and thanks for joining us. It's very awkward for me holding this microphone like this, but I'm going to do my best today. You've been in VA now for 2 years.
Yeah.
It's amazing. Time flies.
Especially when you're having fun.
Yeah, exactly. In these 2 years, you have traveled all over the country, and you've met with hundreds of veterans, caregivers, survivors, and VA employees alike. What does this Veterans Day mean to you, and what would you like to share with us?
Yeah, Jose, thank you very much. You say it feels awkward, but you're such a natural at this. I'm the one who feels awkward. You're such a natural. So I'm thrilled to be here. It's a great opportunity to be both with the vets in the room, and then I know we'll be joined online by several vets as well. This Veterans Day, like last Veterans Day when I was secretary, as with frankly every Veterans Day, is a day for us to say thank you to our veterans, to stop and recognize the fundamental importance of veterans to the national fabric. I said the other day in my annual State of the Veteran speech that veterans are the keeper of the national ethos in so many ways. And so it's important for that reason. But it's also important to recommit ourselves, and I say this as a non-veteran, to serving vets as well as they serve us. So stopping for a day to note the great contributions of veterans to the country and to thank veterans for your service to the country is important. And as, if not even more important, the rest of us to recommit ourselves to a lifetime of action to serve vets as well as vets have served us is what Veterans Day is all about for me.
Yeah, no, absolutely. And for those watching, majority, over half of our staff, our VA staff, are veterans. Like, we really believe in the mission. Is there anything else you would like to add about what's going on with the VA that you'd want to share before we start?
Well, just one last thing, which is I'm here in the VA Medical Center in Washington, D.C., which is a real gem in our national enterprise. And I'll tell you what, service never stopped at our VA medical centers, at our CBOCs, among our regional offices, at our national cemeteries across the country during the pandemic. But how we provided service changed. What was a constant was our workforce, many of them veterans themselves, performing services, providing care, providing benefits to veterans at an extraordinarily high level. More provision of care to more veterans than at any time in our history over the course of the last 2 years. More benefits claims processed in the last year than ever in our history. The second most claims processed in a year was 2021. So that work continues at a high level. But just walking through the hallways here with our VAMC director, Mike Heimel, and seeing the team and seeing how vibrant DC VAMC is, seeing how welcoming it is to our women vets, is great. And so that's why I'm thrilled to be here at the VAMC as well. So that's what I'd say. Thanks to our vets. We're going to serve you as well as you've served us, not just on Veterans Day, but every day. And I'll tell you what, right here in the heart of the nation's capital, the DC VAMC under Mike's leadership is doing a really nice job.
Yeah, I agree. Same experience when I walked in as well, from the volunteers to all the staff in the hallway.
Amen.
Amazing. So before we begin, for those of you in the audience, we would love for you to ask a question of the secretary. So if you have a question, please raise your hand, and one of our teammates right here will come to you with a microphone, and then we will have you ask your question. So when I point to you, we'll go with that. So please get your questions in your head and ready to go. So with that, let's begin.
I thought you were going to say if they're easy questions.
Easy-ish.
Okay. All right.
We're going to go with our first question is coming from MS Teams, from Miss Peggy Adams, who's an Army veteran. Peggy, please ask your question of the secretary.
Thank you for allowing me to be here. My question is, what is the VA doing for the personnel at Fort McClellan, Alabama, in regards to the dioxins that were stored in drums in unlined pits that leaked into the groundwater? The government settled with the town of Anniston, Alabama for $700 or $800 million, but never included the military who are there. When are we going to get recognized? When are we going to get some help with what we're dealing with? And at the same time, Camp Lejeune, they have 4 contaminants in their water, and they're covered. Those 4 have been in the water at Anniston all along, plus many, many more. And yet we're not getting anything. Thank you for letting me ask my question.
Yeah, well, listen, Peggy, I'm really grateful that you asked the question. I'm really grateful that you've set aside some time to join us today. I really want to thank you for bringing this issue to my attention. I want to underscore to you that VA does recognize the concerns that you've just voiced, even though there is not yet scientific evidence to establish a presumption of service connection between service on the base at Fort McClellan and what are commonly referred to as PCBs that were, as I understand it, associated with a location south of the base, and that, as you said, the U.S. government came to a settlement about with Monsanto over the course of the last decade and a half or so. So in all cases, we are continuing to look closely at the connection between those chemicals and service on Fort McClellan. We're looking closely at connections between those chemicals and conditions that are manifesting among our vets. We do not yet have sufficient scientific evidence to establish, as I said a minute ago, a presumption of service connection. Nevertheless, I know I see you're shaking your head. I know you're frustrated on this. Nevertheless, we are continuing to look at it closely in individual cases of vets. And what I'd urge any vet, notwithstanding the fact that there's no service connection for PCBs and service at Fort McClellan, is I'd urge you to file a claim which we can review on a case-by-case basis, even though there is not a presumption of service connection. And the quickest way to do that is at www.ebenefits.gov/ebenefits/homepage. Okay? Peggy, I hear your frustration. I see your frustration on the screen. I'm trying to make sure I'm looking at you at the camera, but I see your face here on the screen. And I want to reassure you that you've brought this to my attention, and I'll make sure that I'm personally pushing on the system here to be responsive. That's not to say that that's any great solace to you, because I know you've been pushing on this yourself for many years. So thank you for bringing it up. I'll stay on top of it. In all cases, if you're a vet, including if you're at Fort McClellan, but anywhere where if you have served anywhere and you feel that you have a condition that you are suffering from, that you incurred as a result of your service, please come see us at VBA, and we'll take it with you from there through the claims process.
Thank you, Peggy, so much for joining us today and providing your question to the Secretary. The next question I'll be asking you, sir.
Yep.
And it's from a Marine Corps veteran by the name of Manuel Gonzalez. And Manuel asks, if the water at Camp Lejeune contains toxic carcinogens, and if you drink it and you got all kinds of cancers, what is the difference between that water and the water we drank from the streams in the jungle when we were out on ops? I got toxic carcinogen on my left kidney, and it was completely removed. Why won't the VA cover it like it does the cancers at Camp Lejeune, or as us Marines say, Lejeune? It's the same kind of cancer.
Yeah, thank you very much. And first, let me just start by saying I am really sorry that you have suffered from cancer. I wish I had words to address what must be both very scary, painful, impactful experience. The top line question here is whether or not we will cover the cancer that you incurred relates to the service connection of it. But let's set that aside for a second. On the difference between cancer incurred through water at Camp, how do you say it? Lejeune. Okay, so I'm going to let the Marine keep saying it for me. Exposure to water in streams on deployment is that we do know that from the 1950s through the 1980s, people living and working on the base at Camp Lejeune were potentially exposed to drinking water that was proven to be contaminated with industrial solvents, including benzene and other chemicals. And we also know, unlike as frustrated as, and I understand as frustrated as Peggy was, we've not yet been able to establish with scientific certainty a connection to the PCBs that were on the property south of Fort McClellan. At Camp Lejeune, we do know that exposure to benzene risks conditions of adult leukemia, aplastic anemia, and other myelodysplastic syndromes, bladder cancer, kidney cancer, liver cancer, multiple myeloma, non-Hodgkin's lymphoma, and Parkinson's disease. Those connections are established in science so tight that there is a presumption of service connection for those deployed in that time period at Camp Lejeune. And we are continually reviewing that science to try to establish additional presumptions of service connection. What we know about water from jungle streams is that those are likely to cause infectious diseases like dysentery, and VA will cover conditions, certain conditions associated with infectious diseases incurred through service, but they are different, obviously, than the cancers. So I again urge anybody watching, if you are experiencing health issues that you associate with your military service, please visit us at VBA, which is the Veterans Benefits Administration within the Veterans Affairs Department, at the address I just gave a minute ago, which is www.ebenefits.va.gov/ebenefits/homepage. So thanks again for the question, Sergeant Gonzalez. I really appreciate it.
Thank you, sir. Any questions from the audience? Terrence.
Mr. Secretary, we have a question from Mr. John Seymour.
Sir? Thank you very much.
Hey, John.
Mr. Secretary, Jose, welcome to the Medical Center, and thank you for the opportunity. My question pertains to the rating system. Sir, have you considered reviewing the current rating process for service-connected injuries? For example, you have if you have a veteran who is at 90%, he needs a unique rating of 50% just to get to 100%. Some veterans have been waiting a long time just to receive the 100% and unable to work regular jobs because of injuries. So that's my question, and thank you.
Yeah, thank you, John. Thank you very much for the question. I get regular correspondence from veterans across the country, taking a page taking a step that I learned from my former boss when I worked in the White House. I make sure that I'm personally reviewing many of those letters each week. In those letters, nothing comes up more than VA math. So I see many vets in the audience knowingly nodding. So I am getting smart on this, John. I know that there's decades of experience on how the calculations factor in to the service connection and the service rating. We are. I will tell you that I've taken as a view that my job should be on focused overwhelmingly on what I call the core course requirements: the provision of timely access to world-class health care, the provision of timely access to benefits, and the provision of accessible access to final resting places for a dignified resting place for our vets. Those I consider the core course requirements. Some of these big structural issues, like the one you're talking about on VA math, to date, I have worried would be a distraction from carrying out those core course requirements. But I hear about it enough from veterans that I'm looking at it. I can't make any final commitments on the fact that we'll reopen it. Would require a lot of work to do that, and my fear is that work ends up being a distraction, as I said, from those core course requirements. But I've heard enough from people like you, from veterans like you, John, that I recognize it as a serious issue, and I'm trying to dig into it.
Yeah, thank you for asking that question. That's really on a lot of veterans' minds, as the Secretary mentioned. I get that, too, everywhere we go.
Yes,
so,
no question.
Yeah, thank you. So the next question is coming from Teams.
Okay.
From an Army veteran, Ms. Terry Hester. Terry, please go ahead and ask your question.
Hi, and thank you so much for your time and for taking our questions today. I'm hopefully have an easier question for you. I'm currently living in Decatur, Texas. I'm about an hour and a half away from the Dallas VA. We do have a small office here. The problem comes with moving and also getting married a few years ago. I have a service-related hearing loss. I've used the VA health system for my hearing issues as well as for primary care over the years, mostly while living in Chattanooga, Tennessee. And so I do want to give very high regards to the VA at Chattanooga. Had great service, both with physical health care, mental health care. So I really appreciated everything they've done for me over the years. But my medical ID is still in my maiden name. And after I got married, everything else is updated. My VA records, DEERS, the VA website, my ID, everything I log into and everywhere I go. But I'm having trouble getting a consistent answer on what I need to do to update that card, that medical ID card, which a lot of people want to see. It's not the same as my driver's license, my passport. It seems like an easy fix. It seems like an easy question, but I've called down to the Dallas folks and get different answers, and I don't want to drive down there until I know I have everything in hand and I'm prepared to get the new ID made. So I appreciate you taking my question today.
Terry, thank you so much for the question, and you're right. It is a very straightforward question, and we owe you a straightforward answer. Before I answer it, let me say thank you for your shout out to the team in Chattanooga. I'm very, I'm watching the data all the time, and Chattanooga regularly scores highly on things on our trackers for performance, for outcomes, and most importantly for what we call the V signal. And while this is not an answer to your question, I just want to pile on here for a second that when you get a survey from us after an engagement at VHA, at one of our medical centers or one of our CBOCs, and going forward after an engagement with us at the Benefits Administration, please just take a minute and give us your feedback. We're trying to track 3 things, and that survey gives us our ability to track 3 things, which is, was it easy for you to get the care you need? Was the care that you got effective? Meaning, was the issue, in your case, Terry, hearing issues? Was the treatment effective? And third, did you feel respected? Which is really important because we work for you. That's the bottom line here. This whole agency exists for one purpose, and it's to serve you. And so if we're not scoring high on the survey in those 3 areas, then we got to change what we do. So one of the things that we've done since I started here, Jose, is we've taken this V signal data and we've put it at www.va.gov/trusts. All the data, all the trust data we have for every facility, every place, every interaction is there. Now, the reason I thought it was important to put it out there is we prosecute that data. We use that as intel to inform our work. But it's also, I've challenged John, your boss, to let's get some fresh eyes on that data to say, are we looking at it wrong? Are there places that we might not be interpreting it correctly? So the most important thing about that data is that it is about your experience. So please take a minute. But Terry, I'm sorry that I took advantage of your question and your comment about Chattanooga to make that point, but I just urge our vets, please, I cannot underscore this enough. We work and we exist for you. So we need to know your experience to determine whether we're being successful. You're the ultimate judge of that. Now, to obtain a new VHIC, as we call it, you can visit the VHIC self-service portal. Have you been told about the portal yet? In all your interactions yet, Terry? You've not heard about this yet?
I don't believe so.
Okay, it's at https://EAUTH, so eauth.va.gov/accessVA. Okay? Or you can go down to Dallas, but I hear what you're saying. You don't want to drive the 90 minutes. You don't want to drive the 90 minutes if you don't have everything you need. So you should get at that portal everything you need, okay, to request the new card. Now, the second option you have and this is for an address or name change. It sounds like you're in your maiden name, right? So you can call us at 877-222-8387. And we can help you with the address and the name change. You can also call us to update the VA benefit records at 800-827-1000. Now, the bottom line is what I'm trying to tell you is you can go down to Dallas, but I don't think you need to. If this doesn't work, I'm going to follow up with you. I'll give you a week or so. I'm going to follow up with you, and we'll do that also through the Veteran Experience Office. And if this hasn't worked, this very simple fix, then I'm going to be very grumpy, but maybe not as grumpy as you are going to be. The last thing I'll just share, because this might be useful for others in the audience, for a new DoD military ID card, which we often get asked about, eligible military members, retirees, or family members can go to https://idco.dmdc.osd.mil/idco. Okay. More than you ever wanted to know, Terry. Thank you. I hope this works, and I'm going to follow up with you in a week. And if it doesn't, then somebody's going to get their butt chewed.
Terry, thank you so much. Truly appreciate your time today. Thank you. And then I wanted to piggyback on what you just said about trust and ease and effectiveness for those veterans who are watching. We really use that data in real time to make changes, because there's also open source where veterans can actually make a comment and the leadership knows exactly what you're thinking. So please, again, like the secretary said, make those comments so we know what's going on, so we can make real-time changes to make it better for you, your experience. So, sorry.
No, please.
Need to mention that since I work in VEO. All right, so next, do we have a question from the audience? We do.
Mr. Secretary, we have a question from Mr. Bill Watkins from Virginia.
Excellent. Hey, Bill.
Hi, sir. How are you?
Good.
Bill Watkins, U.S. Marine Corps veteran from Virginia. Thanks for your time. I appreciate your taking the question. My question is regards to medical records, specifically military, obviously military medical records. I bet I've spent the better part of 15 years, sir, trying to acquire my military medical records. I got out of the Marine Corps in '94 when they were more paper than they were digital. That transition, I think, happened to digitization in the mid-'90s. I subsequently lost my own personal copy, and I've been trying to obtain those. I've recently got knowledge from the VA healthcare application process that they're here. But, sir, I have not been able to acquire them in any particular way. I put in a couple of requests, sent a couple of faxes. It's probably been the better part of 6 months, sir. And the last I'd heard, it maybe is going to be put on a CD and somehow show up at my house. And we were talking to my wife, I'm not sure we've got a CD player. And so thinking to myself, sir, this process has got to be easier for vets.
Yeah.
Is there something that you're looking to do that might address that, sir?
Yeah.
Thank you for taking my question.
Yep. So, thanks for the question. One, thanks for your service to the Corps. Two, and to the country. Three, so we are going through a process to digitize your service records. This has been a major priority for us, frankly, going back the last several years. After we got to this position in the early part of the 2010s, where this reliance on paper was was buckling the floor up in the VA regional office in Baltimore, and was impossible to timely review those records. So we are going through the process of digitizing them, and that might be what somebody is referring to you, which is that as we digitize them, store them in the cloud, that as we develop more automated decision tools, so when you make a claim, for example, we can go prosecute those records using automated decision support tools rather than requiring somebody to leaf through them page by page. So leaving to the machines what machines do well, which is go through a lot of data quickly to pull out the relevant pieces, and then leaving to humans, our great VBA workforce, to do what they do well, which is to make judgment about that analytic information. So the first thing that we're doing is we're digitizing that. And I think what somebody is telling you is they'll get your records from that, get it to you in a digital form. Let's make sure we've got your contact data, I'm sure, here somewhere. I'll make sure that we follow up directly with you, because it doesn't make sense to get it in a digital form if it's in a digital form that's not retrievable. Because I'm just thinking to myself, if I have a CD player at home, I'm pretty sure I don't want to put anything in it, because I'm pretty sure it's probably been compromised by some foreign intelligence actor. So let's, I think that's a really smart point that we'll just fix that, okay? The longer term fix, and this is quite frustrating to me because it's unfortunately too long, is that we are establishing a new digital electronic health record at VA that's meant to be a counterpart to the DoD electronic health record. And the idea is that those systems work well and interact with one another well. In fact, they're actually built by the same contractor. And that will allow us to access digitally your full record from your service in the Corps from the moment you joined until, the moment your care with us is no longer needed, right? So that program has been something that we've been trying to do in different ways in VA for literally decades. And so we're making strides on that, but that's the other part of the answer to your question. So yes, we are working on a structural fix that is frustratingly slow, maddeningly so, in fact. But we'll get that done. But I want to get it done in a time that's useful for you, which is why I want to make sure that I follow up directly with you. Okay? Good.
Yeah, great question. All of us old-time Marine Corps guys, you and I, same era. I got out in '94. I'm going through the same process myself right now, so I feel your pain. So thank you for answering that question.
Yep.
The next question comes from Teams, from a Marine Corps veteran, Alan Reinerson. Alan, are you there?
Yes, I am.
Okay, go ahead and ask your question, Alan. Thank you.
First of all, early happy birthday, Marines.
Hoorah.
There's a lot of Marines here today.
Not on purpose.
So I'm going to try to keep it as brief as possible, but to give context before I ask my question, the nearest VA clinic to me is in about 20 miles. Hospital, which is where I would need to go to see any specialists, is about 60 miles, well over an hour, about an hour and a half drive. I haven't stepped foot in a VA clinic in about 10 years because the last time I went, I was there for 5 hours waiting to get blood drawn. I use private health insurance because it's so much easier and much easier to get appointments in, much easier for the treatment process. And I have to go every 3 months due to blood work, which is why having blood drawn for me was an issue that day. What will be done or is being done to allow veterans to be able to see outside providers? There are issues, and it allow better continuity of care, being that in my case, I've been going to these doctors for years now. To switch from them to VA doctors would be starting all over again. So what is being done that could allow us to be able to see outside care?
Yeah, Alan, thanks very much. It's an excellent question. We, in fact, you may today be eligible for care through your provider in the local community, depending on your particular need and the circumstance, right? And by circumstance, I mean whether you meet certain eligibility criteria. And the eligibility criteria for what we call community care, so we call it care in the direct care system. The direct care system is coming into a clinic or coming into the VA medical center, or care in the community is where we make you a referral into your community. It's going to be dependent on your individual needs and circumstances. I'm going to give you probably more information than you need, but just so you understand the structure of this. Eligibility for care in the community, which is, I think, what you're asking about, which is how can you continue to get your care with your established provider, is based on the mission, what's called the Mission Act. Okay, it was signed into law in 2018. There are 6 criteria that can qualify a veteran to receive community care. And veterans only need to meet one of those 6 criteria to be eligible. So one way to think about this, one basket of eligibility is around drive time. If you're going in for primary care, for mental health care, for extended care, if you have to drive more than 30 minutes for that care, then you're eligible to get a referral into the community, okay? If you're going for specialty care, if you have to drive more than 60 minutes, you'd be eligible to get a referral into the community. So that's just an example here. What I would, what I'd urge you to do is to reestablish with your primary care provider at VA and have this conversation with your provider. So you can look at the eligibility requirements and figure out how it is that we get you referred to your established provider. That's point 1. Point 2, I think reestablishing with your PCP, with your primary care provider, might give you an opportunity to take another look at the clinic, because this is not to say that everything's perfect at VA. I know it is not. I'm looking at you on the screen. I'll look at you through the camera. I'll tell you what, I go to some VA facilities where actually things like blood draws are done quickly and you're in and out of there and you're done. So please give it another look with your PCP and see if in the last, you said you haven't been there in 10 years. My hope is that you'll see things have changed so that you don't have to pay out of your pocket, right? This is why we're here, so you don't have to pay, right? Third and last, one of the reasons that we have trouble with timely access to things like blood draw or to primary care physicians or even to specialists is that we're down on staff, meaning we're short-staffed. Especially after the pandemic, everybody has seen the healthcare labor market tighten. So we are working super aggressively to backfill those needs. We're having a nationwide hiring effort later this fall. We'll have news out of the back end of that about whether we are both hiring more quickly and onboarding those professionals more quickly. Congress has just given us new authority. Republicans and Democrats have just given us new authority and new funding to hire more providers. And that's paid dividends in 2 ways. One, July of this year was the first month this year that we hired more nurses than we lost. to retirement and other things. Moreover, in the last fiscal year, which ended at the end of September, we hired about 2,400 net, a net increase of 2,400 nurses across the VA system. Now, we have to hire 45,000 of them in the next 3 years, so that gives you some perspective. But we're hiring, and that's because Congress has given us new authorities and new capabilities, and we're getting more serious about hiring. So nurses it's working with. Secondly, last month, I'm told, September, I guess we're now in November, so 2 months ago, in September, we hired more front line providers in VA than in any time in the VA's history. So that's another bit of evidence that the hiring is working. This last point I'm trying to make here, Alan, is to just try to urge you to come give us another look, and let's see if we can at least do those blood draws every 3 months much more quickly for you than your last experience on this. In all cases, please reestablish with your PCP. Talk about how we can get you referred so that you're not paying out of your pocket.
Yes, sir. Thank you for your time.
Thank you.
Yeah, thank you, Alan. And the VA has changed in 10 years, so hopefully you'll have that experience when you walk in through those front doors. So thank you
Yes, sir.
again.
Thank you.
Do we have a question from the audience? Yes.
My name is Walter Elmore, and I'm a Vietnam era vet.
Welcome home, Walter.
Thank you. My question is two parts. One, I receive all my medical care from the VA Medical Center here in Washington, D.C.
Good.
I have not brought this to the attention of Mr. Heimel, but
Well, he's about to hear.
I'm receiving trauma services care.
Okay.
I was a part of a 12-week structured group, and that group went from 12-week structured group to a weekly drop-in group by the same individual, the same facilitator. The facilitator left. She said that she thought that she was going to be permanently hired to continue the groups, and she just left, and she said someone was going to be taking the place. The drop-in group has up to 35 veterans on the call, and when she made us aware that she was leaving, some of the people on the group, particularly the female veterans on the group, broke into tears because that weekly group, and I can say this for myself and I can speak for them, it was like a lifeline to be able to talk to somebody about our issues and about our concerns. This was a race-based trauma group.
Okay.
About some of the experiences that we have experienced when I was in the military.
Okay.
Speaking for myself. I don't understand. It's been over a month, and I haven't heard from anybody in trauma services. Nothing at all. That weekly group was a lifeline for me.
Yep.
I haven't heard from anybody.
Okay.
I go out once a week or once every other week, and I volunteer at the only CBOC in Washington, D.C. that has homeless, underserved veterans that live on the property.
Okay.
There's a doctor there that won't see the veterans there. They have to come to the D.C. VA Medical Center to be seen for medical services, or call 911 and get emergency medical services from the district government. I don't understand that. And then they talk about they want to close the facility because it's underutilized. It's underutilized because, and I'm going to say this, the Dr. Peck that's there, she won't see the veterans there. She refuses to see them. Veterans, underserved, low income, and veterans of color are mistreated. I'm not saying by the VA Medical Center, but in the community, they're mistreated. They are mistreated. And that's my concern, and that's what I want to ask you about. And what can you and Mr. Heimel do about that?
Good. And it's Walter, right?
Walter.
Yeah, Walter, thank you. So you raised 2 points. One is making sure that we get that provider who it sounds like has left, get her replaced so that drop-in group, the trauma support group, gets restarted. Mike is sitting right here. We'll make sure that we get that done. I will say, just as I referenced just a minute ago with Alan, the healthcare labor market is extraordinarily tight. The mental health care labor market is even tighter than that. So without knowing the specifics of the case, it's plausible to me that we're having a hard time getting the right person to fill the group, but I'm confident, knowing Mike, that he's moving with urgency on it. But I'm really glad that you brought it up. That's why we're doing a town hall like this, so that it gets our urgent attention. So you've got our attention. We'll get that fixed. You must be talking about the CBOC down in Southeast, is that right? So through the Homeless Program Office, we obviously are actively reaching out to, making sure that we know not only who the homeless veterans are, but what their stories are and what their needs are. And to be honest, the way VA handles homelessness is unlike anybody else in the government. Partly because our professionals, our providers are so excellent, and partly because Congress has been extraordinarily generous, and the White House, the President, have been extraordinarily aggressive in getting us funding to allow us to invest in homeless veterans. That's how, from 2020 until January of this year, January 2022, we saw an 11% reduction in homeless vets. And that's how, over the course of this year, of calendar year 2022, we made a commitment to permanently house 38,000 homeless vets. We're going to meet that goal. We're well over 3/4 of the way there. So as of the end of September, 3/4 of the year, 3/4 of the way through the year, we had more than 3/4 of that goal met. So an important part of that is our strategy of let's get veterans housed, and then let's get them the wraparound services, be it trauma, be it substance use disorder treatment, be it acute mental health disorder treatment. Let's get them the wraparound services they need. So back then to the clinic in Southeast. One of the reasons that we bring the homeless vets here is for precisely the reason I just said, which is we want to ensure that we get all the wraparound services that may not be available in Southeast. So I urge you to not jump to the conclusion that, look, I feel really strongly about our providers. Gutsy, many vets themselves, putting themselves at risk throughout the pandemic to provide care to our veterans. By the way, when you put yourself at risk, you're putting your family at risk too, as you know, because you go through the same thing. I do not believe it's because that provider doesn't want to provide services. I think it's because we want to ensure that those homeless vets get all the care they need. And what do we know about homelessness? We know that there could be a lot of different causes for homelessness. It's not because somebody wants to be homeless. But here's my last thing I'll say about this. I believe in the deepest part of my soul that the word homeless veteran should not exist in the English language. And we will work as tirelessly as we can, as tirelessly as the team here does. And I'm sure you're here on Saturday at Winter Haven, where we provided services, care, support, resources to the homeless vets in DC. We will continue to do that until we do not need that phrase, homeless veteran, because there's going to be zero. And it'll be because of vets like you who are volunteering to help each other, and because of providers like Mike's team and others who refuse to accept that anybody who swore an oath to defend this country should not be homeless in this country, the greatest country on the face of the earth.
Yeah, amen. Thank you, Walter, for bringing that up. Appreciate that.
And we'll make sure you're getting that trauma support group going, Walter. Thank you for raising it.
Do we have another audience question? We do.
Well, I thought the whole thing was easy questions. You're like, come on over to DC VAMC, you'll get easy questions.
I did. You're right.
Well, gentlemen, we have a question from Patricia Ochan. Patricia?
Yes. Thank you, Mr. Secretary.
Hi, Patricia.
Hi. Thank you. Thank you for creating this town hall. We really appreciate you giving us your time. My question is in regards to caregivers. I'm a caregiver for my husband, Jimmy. Mr. Secretary, as you know, caregivers have been at the forefront of helping our veterans, giving them a comfortable
Amen.
place at home,
Amen.
To make sure they heal.
Amen.
We've created environments in our homes
Amen.
to give them peace of mind. A lot of caregivers have sacrificed, given up their careers, to give full-time care to the service members without pay. So, Mr. Secretary, we are so thankful when a stipend was introduced. But now there is word going around that the stipend is going to be removed. Actually, some caregivers are being pushed out of the program, and strangers are now being brought to the home to take care of the service members. I fear that we've worked so hard to get the service members on their feet. A lot of service members are thriving. We've seen the worst, and we are now somewhere in the middle, and things are in control. I have a fear that if somebody new is brought into the home, it's going to take us back for some service members. So, Mr. Secretary, please talk to the caregivers and tell us that we matter and it's going to be okay. Thank you.
Patricia, thanks so much. And some of the questions that we got online when we announced the program, when we announced the town hall, also brought up the caregiver program. So let me talk to the caregivers. Let me talk to you, Patricia. Thanks for the opportunity to do that. One, the caregivers for our veterans are the backbone of the care team. We get really important time with our veterans, but it's never enough. So the fact that we have the caregivers to rely on is fundamental to best outcomes for veterans. For exactly the reason you said, which is that you create an environment for your veteran where they can heal and thrive, feel safe. So the caregiver program with the stipend, we have the program of comprehensive care that comes with the stipend. And we have the general program that does not come with the stipend but provides training, information, networking, and fellowship, and best practices, and increasingly mental health care for the caregiver themselves. These are innovative programs built on the view that caregivers are a fundamental part of the care team for veterans. Not only that, the backbone for that care team. So the question is, it is true. Well, let me put it this way. As of October 1 of this year, so 1 month ago, Now, veterans of every era can become eligible for the program, either the comprehensive program with the stipend or the general program without it. And if you're interested as a caregiver for a veteran of any era, post 9/11, post Gulf War I, Korea, Vietnam, please visit us at caregiver.va.gov and you'll see some information there. So please come see us. Just since October 1, we've had, I was briefed this morning, about 19,000 additional applications to join the program, the expanded program. So please visit us and see if you're eligible. Point one. Point two. Those of you already in the program, we were reviewing people's status for whether they qualify for the new program going forward. Some of you may have gotten a letter saying you no longer qualify for the program and that you're being suspended. That is no longer correct. Everybody in the program will be continued in the program until September 2025. Okay? That's 3 years from now. So if you're in the program today, you will continue until September 2025 at least. In the meantime, we will look at everybody in the program and we'll ask if you meet two questions. One, as the law requires, did your veteran suffer the condition the veteran is suffering from in service to the country? The proxy for that is your veteran 70% service connected? That's the first test. The second test is, what percentage of activities of daily living does your veteran need help on? That second test is not in the statute. Meaning, the first test, 70% service connection, is required by law. The second test is one that we establish. We are expressly looking at that second test to be as inclusive as possible for all veteran caregivers. Between now and September 2025, we will be in conversation with you and other caregivers to make sure you understand the decisions we're making there. So, I can't tell you, Patricia, that, as you said, please speak to the caregivers and tell them everything will be okay. Here's what I can tell you. You are the backbone of the care team. You will, if you're in the program today, you will continue into the program until at least September 2025. Between now and September 2025, we'll fix the program to be as inviting and as accommodating as possible. Lastly, if you are not yet in the program, please apply. The way to apply is to visit us at www.caregiver.va.gov. And if that's James with you, Patricia, I say that's a pretty formidable team. So I can't tell you and James. So I can't tell you everything's going to be okay, but I can tell you that I've only known you now for the last 5 minutes, but I'm pretty sure there's not anything that you and James can't beat together.
Thank you for that. And I'd like to also give out a phone number for caregivers. So if you have a pen, write this down. The VA Caregiver Support Line is 1-855-260-3274. It's a great number for more information. If you have that beyond the website, if you need to talk to somebody, please dial that number and someone will answer your question. Okay, sir, before we wrap it up, we're at time. Is there anything you'd like to add at the end? Maybe let the folks know about PACT and where we're at right now?
Yeah. the most important thing I want to say is thank you to everybody who's joined us online, everybody who took time to send in questions, and everybody who's joined us here in the room. It's gutsy to stand up to ask the Secretary questions, but this is a room full of gutsy people because you already all raised your right hand and said you'd die for the country. So I'm not surprised, but I am still very grateful for your willingness to be as candid with me as you've been. So I thank you all very much. 1, 2, Congress passed, President Biden signed because he promised he would sign it earlier this year when he called on Congress to act. What is at least the largest expansion of VA benefits and VA care in a generation, if not ever. This is for veterans of all eras, but particularly you veterans who served in Central Command, basically from Somalia in the southwest to Uzbekistan in the northeast. From 1991 until 2021, 30 years of war that you and your families sacrificed for. If during your time, if during your service you were exposed to particulate matter, sandstorms in Kuwait, sandstorms that were blowing toxic smoke from burning oil wells in Kuwait or Saudi Arabia, or particulate matter blowing from burn pits in Iraq or Afghanistan, Syria, Uzbekistan, then we want you to file a claim with us and come in and see us for care. We'll leave some information on the screen as we close out today's conversation, but that information is available at va.gov/PACT, or you can always call us at 1-800-MY-VA-411, 1-800-MY-VA-411, so that you can come in and see us and make sure that you're getting care for exposure to those toxins. Okay? A generation of veterans has waited long enough for access to this care. It's time for us to make sure that that happens. Because of the President Biden, because of bipartisan majorities in both houses of Congress, we're in a position to provide that care. So please, come see us, call us. Let's make sure we get you the care that you've earned, the benefits that you've earned. And one more time for Veterans Day, I say thank you. And we endeavor to serve you as well as you've served the country.
Well, Mr. Secretary, thank you again for joining us today. Thank you for asking these candid questions of our veterans. As always, we truly appreciate you and your time. Thank you.
Thanks so much. Thanks, everybody.
And one last thing before we wrap it up. As the Secretary mentioned, please, if you feel like you've been exposed, when you see your primary care provider, ask to be screened for toxic exposures at your next appointment. And with that, I'd like to thank the audience folks for joining us today. And we'd like to thank everybody who's joining in online watching us. And we'd like to wish you all a very happy Veterans Day. And to all my Marine brothers and sisters, happy birthday. Thanks to the VA team for making this happen today. Cheers. Until next time.